Hi, everyone. My name is Yanchi Wilson, here with MedEdge MEA at the Bone Marrow Transplant and Gene Therapy Conference here in Abu Dhabi. I have here with me Professor Faisal Khan, who is going to share with us a little bit more information, kind of a bit of a surprise here, because he's getting ready to speak. And so we're going to get a sneak peek about what he's going to talk about in particular and just have a really amazing conversation. Thank you for being here with me.
Hi. Thank you for having me here. My name is Faisal Khan. I'm a professor in the Faculty of Medicine at University of Calgary in Canada. My research program is focused on identifying biomarkers that can predict leukemia relapse after transplantation.
Okay.
And it is mainly focused on two virtues like biomarkers, which are specific to bone marrow transplant recipients,
Okay.
and biomarkers which are more linked with how the donor's immune system reconstitute after the transplantation within the recipient's body. In today's presentation, I'm going to talk about these two diametrically opposite molecular approaches,
Okay.
each one of them focusing on if we can predict leukemia relapse with high sensitivity, specificity, and enough lead time where a salvage therapy like a donor lymphocyte infusion is applicable.
Okay.
In addition, our program in Canada has a very unique characteristic that it has a translational research arm where we do all these type of translational research activity, and some of the high profile findings ultimately end up going into routine clinical investigation at part of an organization called OncoHelix, who offer these assays and these research as clinical tests globally. OncoHelix currently in United Arab Emirates work together with Burjeel Holdings
Okay.
and have a program here in Abu Dhabi, which actually offers a lot of these molecular tests for different oncology and bone marrow transplant program. So basically, I will be talking about today both the major findings that came out of this translational research program and how they are clinically adapted in Canada and now being offered in the GCC region together in partnership with Burjeel Holdings.
Wonderful. Thank you. Amazing intro, first of all. No, that's extremely interesting. And I'm curious to know what are, given, this, all of the findings and everything that you have found, you are dealing with today, what are some of the technologies that really go into being able to find these specific things?
Right. Molecular approaches these days revolve around one central piece called next generation sequencing.
Okay.
Next generation sequencing has two uses as far as this particular type of work is concerned. One is to identify unique gene signatures which are particularly linked with recipients,
Okay.
so that we start detecting whether recipient cells have started reappearing after the transplantation, because that's the first and foremost sign of an impending relapse. The second use of NGS technology is to identify somatic variants which are linked to these hematological cancers like AML and AR. So we are using next generation sequencing. We are using something called nanostring to assess the transcription profile of immunity related genes. And we are using flow cytometry to confirm these gene level findings at a protein level.
Wow. Okay. So if you end up finding that a transplant recipient has actually relapsed, what then is that next step?
Enough. Um, so, you know, um, Leukemia relapse is a two-edged sword. So if we start giving some sort of salvage therapy called donor lymphocyte infusion to every single patient after transplant, then so many of them who are not at high risk of developing relapse end up developing another complication called graft versus post disease.
Okay, I've heard
and
that a
they-
few times today.
Yeah, and they start dying because of GVHD. And if we don't give donor lymphocyte infusion to everyone, then patients who end up relapsing die because of relapse. So the key here is that we need to identify biomarkers which can correctly identify patients at high risk of relapse and give the donor lymphocyte infusion only to those patients
Got it.
so that you can avoid the toxic effect
Yeah,
but only get the beneficial side of it.
got it.
Now, donor lymphocyte infusion is known to be efficacious if it's given 2 to 3 months before the first sign of relapse,
Okay.
which means these biomarkers need to identify the high risk patient 2 to 3 months before relapse.
So it's a lot of
If they-
testing needs to be done.
If they do, then the patients can be given an extra dose of DLI to prevent the impending relapse.
Okay. So it's a lot of kind of core prevention and seeing the markers as before that.
As I said, the biomarkers need to have pre-characteristics, high sensitivity, so that everyone who is at high risk of relapse can be predicted.
Yep.
High specificity, so that all those who are at low risk of relapse can also be predicted and they should not be treated by DLI. And the third is this whole identification need to have at least 2 to 3 months of lead time so that uh, something like DLI is efficacious.
Yes. Okay. So what are some key things that you would want people to know about your organization and the importance of the work that you're doing?
First, a lot of strong translational research activity in this area are going on all across the world. And in our hand, what we have done that there were a lot of retrospective studies which identified these biomarkers, followed by prospective studies where they were validated in the prospective cohort, and only the one which have a very high success rate both in terms of sensitivity, specificity, and lead time have now been gradually introduced in our routine clinical practice. There's no other way to determine or to use these interventions or these diagnostic tests for the identification of high-risk patients. So right now, together with the Burjeel Holdings here in UAE, we are trying to replicate all this work that we have done in our program in Canada.
That's amazing. That is completely amazing. Dr. Khan, thank you so much for sharing your insights.
Thank you very much for having me here.
This has been truly fantastic.
Thank you.